So making this video just to kind of go over kind of where my skin is at so far and what I'm doing for my skin, and then also just explaining a little more of the things that I've been focusing on, what they told me to focus on to kind of make it help me go through radiation treatment with minimal side effects. So the things they told me to focus on were hydration, protein, rest, and exercise. And so for hydration, you're just drinking enough water. And so I'm really thankful that I got my big bottle at Christmas time, and it's been really helpful this year with chemo and staying hydrated. Not really easy to travel with, so I just kind of leave it at home. So hydration, pretty simple. The next one is protein, and so I found these good protein drinks that taste good, and they have lots of protein, and they're low calorie, low sugar. And again, they taste good. So my sister-in-law bought them for me at the beginning of the year to kind of help with protein intake for breastfeeding. And they've been really helpful. It's this Fairlife. You could buy them at Sam's Club or on Amazon, which are the same price as Sam's Club. They're 30 grams of protein, 150 calories, and 2 grams of sugar. And so, and they taste really good. They have I like the chocolate and caramel, and they also have vanilla. I haven't tried that. So they're not like a meal replacement, they're not high calorie, but they are gonna help you get in the extra protein. And so it's just helpful just to kind of make sure you are getting that extra protein in case you aren't getting it in your food for the day. So for rest, I just, again, been trying to go to bed at a decent hour instead of staying up too late watching TV with Paul or doing stuff around the house. I'm trying to go to bed when I'm tired. And that's been going well so far. Paul's very helpful in reminding me. And then the last one is exercise. I've been running, and that's also helping me with sleep. So the way that radiation works, from how I understand it, is the area that is being radiated, those cells are being broken down every single day, and they need to repair. So they need hydration and protein to repair themselves. And the good cells are going to repair every single day. Over time, they keep getting more and more broken down, but since they're healthy, the healthy cells are going to repair. The cancer cells, if there are any hidden in there, they are not able to repair themselves like the healthy cells. And so instead of multiplying as cancer does, those cells are going to die off. And so that's the goal. That's why, you're going to radiation every single day, and it's so those cancer cells can't repair themselves, but your healthy cells can. So because of that, I am probably going to experience some skin irritation and some burns possibly. And so these are the things that my doctors recommended and for skincare. And so the first thing they had me buy was, which I already had in the house, was Aquaphor. This is Aquaphor Ointment. I haven't used this much. I'm going to use it at the end because it is the ointment, and so it's really sticky, and if you're wearing clothing, or going places, it's just not really suitable to use all the time. But Aquaphor does have very minimal ingredients in it, so most people are not allergic. This next product is Calendula Ointment, and again, this is another ointment, so I haven't used much of it. But this was so I think Aquaphor is $5 or less. This was another $5. Maybe it was $8 on Amazon. So it's first aid, cut, scrapes, minor burns, chapped skin. And this Calendula, I think I'm saying it right, ingredient, which I think comes from a plant, is inside a couple of the other products that were recommended. Again, I haven't used this. I'm going to use it towards the end if I need to because it is an ointment. Ultra Lotion, which is therapy lotion, hydrates skin, sensitive skin, reduces redness, and promotes natural healing. Fragrance-free. I didn't like this because it's not fragrance-free. I did not like the smell. It had a weird smell to it, not a scent they were trying. It was just I just didn't like it. And they were kind of concerned that this is what I had an early reaction to. I don't think that's true because I haven't used this in a couple weeks and I still have the same issue. But she was thinking maybe I was allergic to the lanolin oil in here. And if you're familiar with lanolin, if you breastfeed, I've used it before and never had a problem. But yeah, so lotion, great if you don't mind the smell. And this was like $14, $18 on Amazon. I think you can get this from your pharmacy though. And then the last thing they recommended was aloe, and I did just buy an aloe plant, which I'm gonna need to replace because I'm like using it faster than it can grow back. Basically, you can buy 100% aloe or like an aloe plant, but I just cut it and like open it up and just put it on my skin. So again, I've used the aloe. I stopped using the Ultra, and I haven't used the ointments yet. But what I did end up buying, and I talked to my doctor, it's highly recommended from like other things I read, is this Mioderm radiation cream. And this actually is fragrance free, and it's a lotion, and so it's not like ointmenty. I got 2 4-ounce bottles. One's in my purse right now. I use this a lot. Like I use this first thing in the morning, after radiation, after my shower, and like in the evening. Sometimes I'll swap one of those out for using aloe right now. But it was kind of expensive on Amazon because I guess there's like just the supply chain and everything going on right now. It's like hard to find, and so it was like $70 for 2 things of this. But I guess sometimes you can find it in your pharmacy. This does have that Calendula, whatever it's called, ointment. No, this one doesn't. I'm sorry. Okay. So this says, developed by radiation oncologists or patients receiving radiation therapy as part of their cancer treatment, formula ingredients clinically proven to reduce radiation and promote wound healing. So I got 2 of those, and then I also, for $10 more, got the bar of soap. This does have the Calendula in it, along with goat milk soap. And so just like a bar of soap, and I just use that to clean like under my armpit and my whole radiated area every day, because it's like sensitive. You're not supposed to use like harsh chemicals or anything like that. I'm even careful like with any other soap, not even getting it close to my radiated area because I don't want to like deal with anything like that. And it came with a bunch of other like pamphlets and stuff. And you can buy some of this cream with lidocaine in it, which is like a topical anesthetic. If you're having a lot of pain, I don't have any, but at the end, if like I did, that might be something I would buy. So, yeah, that's kind of what's going on right now. Again, I just have like some redness, and like sometimes my skin's kind of like purpley or extra red, but I don't have any like pain or discomfort or itching or anything like that right now. Check in at the end though, to kind of see, this is what I'm using and how I'm like going through treatment right now, and it's been going well, but definitely check in at the end to kind of see how I keep up. And I'm curious, I'm hoping that everything turns out okay. Thanks. Monday. That means I'm about to go in. After today, I'll be halfway done with radiation. I have 15 of my 30 treatments done. Should be pretty easy today. Sometimes they're a tiny bit longer, like minutes longer, because I do a little more imaging on Mondays. But yeah, it should be good. I think I mentioned, I don't remember, but I did get new stickers on last Monday, and so I think every couple of weeks they'll take out the old ones and put the new ones on, which is nice because after a while, it's kind of gross having it on you. And I'm looking forward to it. Over the weekend, I did have some more skin issues. Nothing horrible, but like a lot more itching, kind of like in this area, and just some discomfort and redness. It actually looks okay today, but over the weekend it did get a little irritated. But it's not like that bad yet, or I don't think about it that much, but the itching is something, so I'll probably ask about what I can use for itching, because the products I have, they're not like necessarily for itching, and so I should see if there's anything else I can use, or just do what I'm doing. But yeah, so halfway done.